Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
And hello again, everyone, and thanks very much for joining us. Recent days have demonstrated that Arkansas's battle against coronavirus is anything but over, not even close. We're past 10,000 diagnoses now, and the surge in confirmed cases seems to be based in northwest Arkansas. And of special concern, naturally, are the close quarters of labor-intensive manufacturing facilities, notably poultry processing plants. The industry says it's taking appropriate recommended precautions to protect workers. Still, the outbreak this week has produced scores of infections among line employees and their relatives, many of them Hispanic and Marshallese immigrants. So how to address the problem? We're joined in this edition by Judd Semingson, Chief Executive Officer of the nonprofit Community Clinics of Northwest Arkansas, based at Springdale, and Dr. Jose Romero, Governor Hutchinson's Secretary Designate of the Arkansas Department of Health. Thank you very much for being with us. Dr. Romero, we'll begin with you. I suspect the numbers simply speak for themselves, but I'll ask for your take.
They are clearly increasing, as you stated clearly early in this broadcast. It is not unexpected. We know that the COVID pandemic is far from over. We did expect continuing rise in cases. As you indicated, the northwest part of our state is currently the fastest growing number of cases in the state.
And if I'm reading the statistics correctly, Dr. Romero, the analyses of the reported cases, Benton and Washington counties are taking the brunt of it.
That is correct. Those are the two counties that are contributing the most number of cases at this moment.
And is the surge definitely, we can track that to the poultry industry?
No, we cannot.
All right.
So we are in the process of looking at that, and we at this time cannot say definitively that transmission is occurring from the poultry industry. We're looking at all aspects. As a matter of fact, the CDC is sending a team of epidemiologists here. They will be here, I believe, this week, and will assist us in attempting to determine where this is coming from, and also working with minority populations in that part of the state in order to see whether there's transmission occurring in the homes or in the community.
Well, and this might be a good time to advise the audience that we did attempt to secure a representative from the poultry industry and to appear on the broadcast, and were unsuccessful. Let me turn to Mr. Semingson. You're having to deal with the surge.
Indeed, we are. And we have certainly seen a rise in the recent weeks in our number of tests that we're performing, as well as the number of positives that we are seeing.
And manifesting in what way? There's a definite ethnic aspect to this, is there not?
There is. If we go back, we at Community Clinic, we have been testing since approximately mid-March. And in the first 2 months of tests, we initially saw a rise in our Marshallese community. This is a community that is typically very close-knit and is very social. And so that was our first rise. And so going back to mid-May, that was the group that we saw initially having a significant increase, where of our testing that was performed, that group comprised about 41% of our total positives. At that time, we only saw about 34% of our tests being performed in the Hispanic population. And in talking to some of our local community leaders within our Hispanic groups, we questioned that, why there weren't more Hispanic members of the community getting tested. There was a lot of unknowns to that. We have certainly seen over the last several weeks that population has increased their testing dramatically.
Well, and either of you gentlemen correct me if I'm wrong here, but using health department statistics, it appears that, Latinos are approximately 7.5–8% of the population. They're now 19% of the active coronavirus cases. Dr. Romero, you concur with that?
That is correct. That is correct. And it's important to note that the Latinos and Marshallese are essential workers. They're engaged in activities that are essential to our economy. And we would expect them to have an increase. We certainly have been seeing more testing in the Latino population in the last few weeks. Part of that, I think, has to do with some of our messaging. Myself and a number of bilingual employees here at the health department are engaging in radio interviews and myself television interviews to inform the public in general about this. One of the questions that I received early on was the cost of the examination and how to go about getting that. And as you know, the governor and the Secretary of Health have opened up testing in our local health units and without charge. And I think that in part, and because the Latino population understands that they are an essential workforce, has driven them, not driven them, but has led them to undertake testing. And that's exactly what we want. We want to know where these infections are occurring in our communities.
Well, Mr. Semingson seemed to suggest just a second ago, though, that there was an undue lag, if I heard him correctly, delay in testing in Northwest Arkansas, particularly among Latinos, Marshallese. Would you concur with that?
I don't know that there was a lag. There was a time where Latinos were not being tested as frequently, and I don't know that that was a purposeful decision not to test them. We certainly have reached out to the Northwest area, providing diagnostic platforms for their use, and have encouraged their use in populations in their community. I think really the issue about Latinos has been communicating with them the importance of having the testing, and now that they're understanding that this testing is for free, because they live on tight budgets, and so to test a family or to test multiple members of a family could be very expensive for them.
Well, both gentlemen, and Mr. Semingson, we'll start with you. Have you encountered we sometimes are given to understand that there are cultural inhibitions, social inhibitions in immigrant communities of any nationality to access the traditional healthcare system in the United States, including Arkansas. Have you encountered that?
Yes, and as we look at trust and we look at trust with various agencies, and I would agree with Dr. Romero. I don't believe that the initial component of testing really indicates a lag. I think it was a matter of not taking advantage of it. Community clinic as a community health center, our mission and our mantra really is access for healthcare and access for equitable healthcare. And so we really want to be in tune to echo what Dr. Romero said is our goal is to be able to provide health care regardless of the patient's ability to pay. And so those were very much concerns when we talk about financial concerns of many of the communities that we see. At our clinic, in our system, approximately 95% of our patient population is at or below 200% of the federal poverty guidelines. So finances are very much a concern for many of our patients. And so that's really a space that we have worked over the last 20 years to reduce those barriers. But as far as trust and being able to take advantage in healthcare and in traditional models, our goal is to really be representative of the communities that we serve.
I'm sorry, go ahead.
Well, I was going to say, for us, about 56% of our patients in 2019 were Hispanic or Latino, and subsequently about 60 to 65% of our employees are bilingual to be able to allow groups to come in, be it Hispanic, Marshallese, and any of our minority populations, and really have a comfort level here for their health care.
Dr. Romero?
So I think you're correct in saying that culturally different populations use healthcare systems differently. And I, as a practicing clinician, note the differences between Latino and Marshallese populations and Caucasian populations. But having said that, the understanding of these populations that they have access to healthcare either through places like the community clinics that are available to them. That allows them to gain access to them and to use those systems. So we try to make sure that they know that that's available and they can come to us at any time.
Is immigration status a concern? There is so much misinformation and so much apprehension. Whether it's justified or not, I'll let you address, in terms of accessing any government program or any social services agency among immigrant communities, but particularly the Hispanic community. Dr. Romero.
Sure. So yes, clearly that is an issue that I've had questions asked about. Will they be reported? Is there a risk to them? And we've tried to explain to them that the most important thing is that they are tested. That we want to know what their status of COVID is. We're not interested. We're not going to collect information regarding about their immigration status. But clearly, there are individuals that live in the margins of our society and in the shadows, if you will, because of the issue of immigration and being found to have improperly entered the country. So, but we still need to know what's going on with the entire population. And we need to make access to testing and to treatment, if available, available to them.
Judd Semingson, you encounter this in patients, dealing with patients?
We do, and we see a lot of fear that is manifested in the communities that we see. Last year, there was an update to the public charge, which expanded services that were considered to negatively affect potentially one's citizenship status. And to that degree, we saw patients that were not wanting to engage with specific services. And so part of our message to that degree with this outbreak is again, we are here to be able to provide regardless of immigration status, and there has been a number of opportunities to be able to have that message that COVID has been excluded as a public charged test. And so that's a big message that we want to make sure that we're getting patients to come in and get tested.
Are you getting through with that message, though? You feel you are?
I think so.
Both of you.
I'm sorry, go ahead.
Dr. Romero, we'll start with you. Yeah.
Very good, sir. So I do think we're getting it. I think we're getting across that message, and the more we hear it, the more we put it out there for them to hear. I think the more they're going to understand that it is important. That is one of the things that I always mention, that we are collecting data on the disease, not on the individual's immigration status.
All right, Mr. Semingson.
Well, 100% agree, and that's been. Our goal has really been to continue to engage with our local community members and our local community leaders. Those have been big questions that have been asked, and we want to really reiterate that our goal is to provide health for our communities. And so that's a big space that we continue to push forward.
Speak, if you will, both gentlemen, if you will, to the close quarters that are we're given to understand, so common in the Latino community, or any immigrant community, but particularly the Latino community in Arkansas. We have heard now for the past half year, we've become familiar with the phrase congregate settings. And I think Dr. Romero emphasized the close social and cultural nature of the Latino community. They tend to reside in fairly close quarters with in many cases, little choice for economic reasons as well. Dr. Romero?
Right, that is true, and it's also very true for the Marshallese populations. So they do tend to live in closer quarters. They're socially more interactive with their communities, and that certainly would facilitate the transmission of COVID within that group. But again, we deal with what we have, and if the cultural norms of that group of individuals calls for very close relationships between themselves, their families, and the community, then we have to address those and offer measures that will mitigate or decrease the transmission of COVID in that community. We have stressed very, very clearly the importance of using face masks, of using facial coverings, of social distancing as much as possible, and avoiding parties, avoiding large get-togethers among the Latino community, because we want to decrease transmission through that mechanism.
Yeah, Judd Semingson, you spoke a moment ago and prior to the broadcast about the surge in your caseload from the Latino community just in the past 2 weeks. Is the message getting through?
I do believe so. And again, the big context here is really trying to make sure that when we talk about social gatherings, this was in an early setting. We've modified our message to make sure that we continue to be consistent with the goal of social distancing. This does not come naturally, and especially talking with some of our Marshallese leaders in Northwest Arkansas, this is not a natural process for the gatherings in the community. And so that has represented a change, and I think the leadership within the community has embraced that, knowing that the goal is to protect the members of the community and really having a consistent message to that. So indeed, there has been a surge, of course, but at the same token, there are challenges. When we talk about multiple families living in the household, how do you quarantine an individual out of that household when there are no areas for them to go to be isolated?
I'll try from this angle, though. The doctor mentioned the industry itself has issued numerous releases about the steps, press releases, about the steps that it is taking to protect its line workers. Once that line worker goes home, back into, no matter how many people may reside in a single dwelling, financially speaking, economically speaking, are those households able to secure the protective equipment that they need and to follow the hygienic practices that the medical community has long recommended?
So if I may begin.
Doctor, please, yeah.
Yes. So these methods for isolation, self-isolation within the home, again, are as mentioned previously by Dr. Simonson, they're difficult in a family where you have a 3 or 4 room home and you have multiple members there. But the measures simply are to try to isolate yourself from the family. Good hand washing, if possible. You can make a face mask out of or a face shield, if you will, out of a T-shirt. I mean, that's possible. We need to educate them and provide this information to the community. The other issue I think that is also very important is that many of these homes are single breadwinners. Families. And if they go into quarantine, this imposes a significant financial strain on the home. We've had calls about this. We, as the Arkansas Department of Health, are working with the community in order to deal with these issues to help the family stay in quarantine. Many times they have to leave the home to purchase groceries. So we're trying to keep them at home as much as possible and provide food there at their doorstep.
And Mr. Semingson, that is, the doctor pointed out, one case of the virus in a household can drop an economic bomb on a family.
Indeed. And so that is but at the same token, it's very important to work for the education to know that in many cases, it is so important to be able to quarantine. As we looked out the other day in Governor Hutchinson's press conference, 100 positives have been 200 plus contacts. And so those are challenges that we face as far as the economics of it to the household. But on the flip side of that, we are also trying to be proactive in protecting the community at large. And so working with the households, Dr. Romero mentioned food, that is possibly the number one request that we get at community clinic. And so like the Department of Health, we've taken steps that are not normal for us, but in this time of collecting food donations and connecting families with food to help with some of those. And the other part of that is connecting families with resources. So we've been very fortunate in Northwest Arkansas where we have certain groups that are helping with things such as rent assistance or utility assistance. And so that's a part where we want to continue to be proactive in connecting families and households with those resources so that they're able to maintain that household in the economic challenging times.
Yeah, Mr. Semingson, have you encountered patients, or are you aware of patients who are fearful of not returning to work?
Is the question, are they fearful of losing their jobs?
Correct.
Or
yes.
Is the question,
for
are
the
they
simple reason
okay.
of losing their jobs.
We have heard certainly there is a fear of losing the jobs. Again, whether or not that is the foundation of that, I don't know. But certainly that is a theme that we continue to hear throughout multiple industries in Northwest Arkansas.
All right, Dr. Romero, you want to make any comment on that? That's a public policy matter, a little bit outside the clinical, but not entirely.
I have heard concerns that workers might lose their employment, but again, it is a concern. We try to calm them as much as possible. I haven't heard of anybody actually losing their job because of COVID infection and loss of time at work. So I may not be the best person to ask about that.
There is a new partnership, I believe, that was announced sometime, or a handshake, if you will, between UAMS and the Health Department. I think this was Senator Ingram's initiative. Is that up and running? It involves tracing and outreach. Is that up and running now? And is it producing results?
So we have moved forward on our contact tracing. Our contact tracers, we're acquiring more contact tracers that are bilingual, both Marshallese and Spanish, English, so that we can reach out to these individuals. So yes, these programs are in process, and they will continue to increase. We know that we have to reach these individuals, and reaching them in a linguistically appropriate manner is essential.
Let's talk for a second about the clinics, sir. And I'm talking to Mr. Semingson here. Or if this surge continues, as everyone seems to agree, Dr. Romero just pointed it out, are you equipped for it? Is the state equipped for it at this point?
Well, I can speak on behalf of Community Clinic, and we have worked very diligently to try to put ourselves in a good position to be equipped for it. Again, we were very early on, created testing sites in an environment to provide access for patients, but also trying to provide safety for our employees, working to acquire personal protective equipment. As a member of Community Health Centers of Arkansas, our group really has systems that are in place throughout the state. And again, the mission of all of us really is the same, in that we want to provide access for those that may not get it, and what would traditionally be called a safety net. So throughout our organization, we've had calls and discussions to make sure that we continue to prepare for it. At this moment, looking forward, there are challenges, but I would certainly say that on our behalf, we're prepared for the immediate future.
Well, the immediate future may be closer than we think, in that many experts, the oft-quoted Dr. Fauci, is quite fearful, publicly so, of a surge come autumn. Do you share that concern? Seem likely to you?
I would say, based on certainly the information that I'm aware of, that's a good possibility. And as we look forward, we're already having discussions of what the cold and flu season looks like with the addition of COVID. And how we can best prepare our clinics and our physical environments and our staff to be safe with that. And whereas, we used to talk about having 5-year plans, now it seems like we have 5-hour plans because things are changing so rapidly. So it is difficult to try to look beyond the immediate, but those are discussions that I know we're already having to prepare.
Have we reopened too soon? Gradual, though it may be too gradual to suit a lot of people. But is the reopening occurring too soon? Mr. Semingson, we'll start with you.
Again, I'm not sure that I'm the best person to answer. If we look at where we're seeing the increase in our numbers, typically these were individuals that, again, are essential workers and have been going to work and have been part of the community and the economy regardless. So I don't, this surge may or may not be tied to that opening process.
Well, if any Is there anything the average citizen can do, from your perspective, other than continue to socially distance and follow the clinician's advice? A lot of hand wash. Some of us are getting chapped hands. We're happy to do it, though.
Well, I think one of the big things is, again, as we continue to go out into public, I wear a mask. My family wears masks. However, I do see a large number of individuals at stores that are not wearing masks. And that has continued to be a discussion point to really reduce the spread. There's been an estimate where it can be a third of patients that have this virus may not have symptoms for it. And so that is, I think, a big message that continues to need to be pushed, is that personal responsibility to help stop the spread as well.
Judd Semingson, we thank you so much for being a part of the program. We thank Dr. Jose Romero as well, who, regrettably, we lost for technical reasons just a couple of minutes ago. We're happy we didn't lose you. That's our broadcast for this week. See you next time.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.